41. What is the priority action for a nurse when a patient's urinary catheter output is less than 30 milliliters per hour? Answer. Assess for catheter obstruction and notify the provider. Rationale. Oliguria or obstruction requires immediate evaluation to prevent renal injury, per CDC catheter care guidelines. 42. What should the nurse do when a patient with limited mobility needs repositioning? Answer. Use a draw sheet and at least 2 staff members to reposition safely. Rationale. Proper technique and adequate staff prevent injury to the patient and nurse, per Occupational Safety and Health Administration, OSHA, lifting guidelines. 43. What is the best action for a nurse when a patient reports nausea before a meal? Answer. Administer prescribed antiemetics and assess the cause of nausea. Rationale. Antiemetics relieve nausea, and assessment identifies underlying issues, promoting comfort, per ANA clinical standards. 44. What should the nurse do to ensure proper hand hygiene before patient care? Answer. Wash hands with soap and water or use alcohol-based hand rub for at least 20 seconds. Rationale. Hand hygiene is the primary infection prevention measure, reducing pathogen transmission, per CDC hand hygiene guidelines. 45. What is the priority action for a nurse when a patient's oxygen saturation drops to 85%? Answer. Increase oxygen flow and notify the provider immediately. Rationale. Severe hypoxemia requires immediate oxygen adjustment and provider intervention to prevent organ damage, per EACN standards. 46. What should the nurse do when a patient with a language barrier needs discharge instructions? Answer. Use a certified medical interpreter to provide instructions. Rationale. Accurate communication ensures patient understanding and adherence, per Joint Commission standards for culturally competent care. 47. What is the best action for a nurse when a patient's wound shows signs of infection? Answer. Notify the provider and obtain a wound culture. Rationale. Infection requires prompt treatment. Culturing identifies the pathogen, guiding therapy, per CDC wound care guidelines. 48. What should the nurse do to prevent medication errors during administration? Answer. Verify the 5 rights of medication administration. Rationale. Checking patient, drug, dose, route, and time ensures safe administration, per ISMP medication safety guidelines. 49. What is the priority action for a nurse when a patient with a cast reports numbness in the extremity? Answer. Notify the provider and assess neurovascular status. Rationale. Numbness may indicate compartment syndrome, a medical emergency. Assessment and notification ensure timely intervention, per ANA clinical standards. 50. What should the nurse do to promote cultural sensitivity for a patient with specific dietary preferences? Answer. Consult with a dietitian to accommodate the patient's preferences. Rationale. Respecting cultural dietary needs promotes patient satisfaction and adherence, per ANA standards for culturally sensitive care. 51. What is the best action for a nurse when a patient's infusion is not flowing properly? Answer. Check for kinks, occlusion, or infiltration and adjust as needed. Rationale. Ensuring proper flow prevents complications like infiltration or delayed therapy, per INS infusion standards. 52. What should the nurse do when a patient with a colostomy needs pouch care? Answer. Clean the stoma site and apply a new pouch securely. Rationale. Proper care prevents skin breakdown and ensures appliance function, per Wound, Ostomy, and Continence Nurses Society, WOCN, guidelines. 53. What is the priority action for a nurse when a patient reports shortness of breath? Answer. Assess respiratory status and administer oxygen if needed. Rationale. Shortness of breath indicates potential respiratory distress, requiring immediate assessment and intervention, per EACN standards. 54. What should the nurse do to ensure proper body mechanics when lifting a patient? Answer. Use leg muscles, keep the back straight, and avoid twisting. Rationale. Proper mechanics prevent nurse injury, ensuring safe patient handling, per OSHA ergonomic guidelines. 55. What is the best action for a nurse when a patient's pulse is weak and thready? Answer. Assess for signs of shock and notify the provider. Rationale: a weak, thready pulse may indicate hypovolemia or shock, requiring urgent evaluation, per AHA standards. 56. What should the nurse do when a patient with a new ostomy feels embarrassed? Answer: provide emotional support and educate about ostomy care. Rationale: support and education reduce stigma and promote self-care, per WOCN patient-centered care guidelines. 57. What is the priority action for a nurse when a patient's NG tube is clogged? Answer: attempt to flush the tube with water and notify the provider if unsuccessful. Rationale: clearing the clog restores function, but persistent obstruction requires provider intervention, per ANA clinical standards. 58. What should the nurse do to prevent cross-contamination in a multi-patient room? Answer: use dedicated equipment for each patient and perform hand hygiene between patients. Rationale: dedicated equipment and hand hygiene prevent pathogen spread, per CDC infection control guidelines. 59. What is the best action for a nurse when a patient with COPD reports fatigue during bathing? Answer: allow rest periods and provide assistance as needed. Rationale: rest conserves energy and assistance ensures safety for patients with limited endurance, per COPD Foundation care guidelines. 60. What should the nurse do when a patient's family is interfering with care decisions? Answer: discuss the patient's wishes privately and involve the healthcare team. Rationale: respecting patient autonomy while addressing family dynamics ensures ethical care, per ANA Code of Ethics. 61. What is the priority action for a nurse when a patient's dressing adheres to a wound? Answer: moisten the dressing with sterile saline before removal. Rationale: moistening prevents tissue damage and pain, maintaining wound integrity, per CDC wound care guidelines. 62. What should the nurse do to promote patient safety during a bath? Answer: ensure the floor is dry and use non-slip mats. Rationale: a dry, non-slip surface prevents falls, a key safety measure, per Joint Commission fall prevention standards. 63. What is the best action for a nurse when a patient reports burning during urination? Answer: assess for urinary tract infection and notify the provider. Rationale: burning suggests infection, requiring evaluation and treatment to prevent complications, per CDC UTI guidelines. 64. What should the nurse do when preparing to administer a subcutaneous injection? Answer: pinch the skin and insert the needle at a 45-degree angle. Rationale: proper technique ensures medication delivery into subcutaneous tissue, per ISMP injection safety guidelines. 65. What is the priority action for a nurse when a patient's oxygen mask is causing skin irritation? Answer: apply a protective barrier and adjust the mask fit. Rationale: preventing skin breakdown ensures comfort and compliance with oxygen therapy, per AACN standards. 66. What should the nurse do to support a patient's spiritual needs? Answer: ask about spiritual preferences and arrange for appropriate support. Rationale: addressing spiritual needs promotes holistic care and patient well-being, per ANA Holistic Nursing Standards. 67. What is the best action for a nurse when a patient's wound drainage increases? Answer: assess the wound and notify the provider. Rationale: increased drainage may indicate infection or dehiscence, requiring evaluation, per CDC wound care guidelines. 68. What should the nurse do when a patient with a visual impairment needs assistance with meals? Answer: describe the plate layout using a clock face method. Rationale: the clock face method promotes independence and safety, per ANA standards for sensory impaired care. 69. What is the priority action for a nurse when a patient's 4 pump alarms for occlusion? Answer: check the tubing for kinks or clots and flush if needed. Rationale: resolving occlusion restores infusion, preventing delays in therapy, per INS infusion standards. 70. What should the nurse do to promote hydration in a patient with nausea? Answer: offer small, frequent sips of clear fluids. Rationale: small sips prevent vomiting and promote hydration, per ANA Fundamental Care Standards. 71. What is the best action for a nurse when a patient reports feeling unsafe in the hospital? Answer: listen to the patient's concerns and address specific safety issues. Rationale: validating concerns and taking action build trust and ensure a safe environment per Joint Commission patient-centered care standards. 72. What should the nurse do when a patient with a Foley catheter reports discomfort? Answer: assess the catheter for proper placement and secure it appropriately. Rationale: misplacement or movement causes discomfort. Proper securing prevents complications per CDC catheter care guidelines. 73. What is the priority action for a nurse when a patient's respiratory rate is 8 breaths per minute? Answer: assess for opioid overdose and administer naloxone if prescribed. Rationale: bradypnea may indicate respiratory depression, requiring immediate reversal, per AHA opioid overdose guidelines. 74. What should the nurse do to prevent skin breakdown in a patient with incontinence? Answer: clean and dry the skin promptly and apply a barrier cream. Rationale: prompt cleaning and barriers prevent moisture-related damage per NPIAP skin care guidelines. 75. What is the best action for a nurse when a patient with a new tracheostomy is coughing excessively? Answer: suction the tracheostomy and assess for mucus plugs. Rationale: excessive coughing may indicate obstruction. Suctioning clears the airway per ACN tracheostomy care standards. 76. What should the nurse do when a patient requests to speak with a supervisor? Answer: acknowledge the request and notify the charge nurse promptly. Rationale: prompt escalation respects patient concerns and ensures resolution per Joint Commission patient rights standards. 77. What is the priority action for a nurse when a patient's blood glucose is 50 milligrams per deciliter? Answer: administer a fast-acting carbohydrate and recheck glucose. Rationale: hypoglycemia requires immediate treatment to prevent seizures or coma per ADA hypoglycemia guidelines. 78. What should the nurse do to promote comfort in a patient with a fever? Answer: apply a cool compress and ensure light bedding. Rationale: cooling measures and light bedding reduce discomfort without causing shivering per CDC fever management guidelines. 79. What is the best action for a nurse when a patient's NG tube is not draining? Answer: reposition the tube and check for kinks or blockages. Rationale: repositioning or clearing blockages restores drainage, preventing complications per ANA clinical standards. 80. What should the nurse do when a patient with a mobility aid needs to ambulate? Answer: ensure the aid is stable and assist the patient as needed. Rationale: a stable aid and assistance prevent falls, promoting safe mobility per Joint Commission fall prevention guidelines.